Well, good evening, everyone, and thank you for joining us tonight for this special Just for Kids presentation. I'm Amy Lynn. We are teaming up tonight with Niswonger Children's Hospital for a discussion on mental health and our children. Such an important topic. Over the next 30 minutes, we will be taking your calls and answering your questions. We know that these past couple of years have been extremely difficult for so many families and especially for children. We do have a number here on your screen. If you have a question, you can call that number right now. We have people standing by to take your phone calls this evening. And we want to get started by introducing our panel of experts. Tonight, we have Dr. Carlos Izaza, a psychiatrist at Woodridge Hospital in the Willow unit, which is the pediatric unit of the hospital. Also, we have Angie Tolley here with us, lead therapist with behavioral health. And we have Dr. Heather Champney, emergency medicine physician with Niswonger Children's Hospital. And we want to thank all of you for being here tonight for such an important discussion.
Thank you.
Thank you. Thank you. Well, certainly let's kind of talk a little bit about mental health and sort of the state of affairs with what we're seeing in our area. And you sent me some information, Dr. Izaza, that we're in a state of emergency right now when it comes to mental health, especially for our adolescents.
We are, Amy. It's a pretty grim picture. The American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry declared a state of emergency at the end of last year. We've known for a long time that death by suicide is the #2 cause of death for our young people, which is a pretty alarming fact. What really became concerning as you track the numbers from 2019, 2020, 2021, we saw a really dramatic increase in the crisis and the suicidality and the self-harming behaviors of our young people. And our emergency departments were flooded with these cases needing crisis support and evaluation. And that's one of the issues that prompted the state of emergency. And my colleague, Dr. Champney, an ER physician, she can attest that this is not just a national problem. This really is a local problem impacting our community.
Yeah, you said the numbers are really staggering. The increases that you're seeing really coincide with that state of emergency.
Absolutely. So we initially actually saw a significant decrease in accessing of emergency services just across the board for all types of emergencies. And we just sort of knew we were waiting because that also meant that those who needed help the most were probably not getting it at all. And then as things started to evolve, yes, we became flooded with mostly adolescents, but also that 5 to 11 age range as well, needing evaluation for behavioral health crises, and they have nowhere else to go, so they come to the emergency room.
And you said about what percentage do you think are coming in for issues relating to mental health?
Well, I don't know precisely what our percentages are, but I would say that with all of our patients, even if they're there for something that's a non-mental health emergency, there's something there. There's something that we can address, or something that maybe hasn't been addressed properly because they haven't been able to access their resources. So specific mental health patients, we almost always have patients that are there for that, but then we also have those issues that come up with just your general emergency room sorts of visits as well. So it's really important to ask patients about those things as well.
Yeah, and Angie, what are you seeing? What are some of your experiences when it comes to mental health and the children in our area?
Well, the amount of anxiety and fear that we see, our calls with invalid behavioral health, we're working to build a continuum system of care. So Dr. Izaza here is, of course, from the inpatient, and I represent, for the most part, outpatient. And so the number of calls, the number of clients that we have are increasing daily. And the number of children and youth that we see on the outpatient side as well is multitudes more than it was 2 years ago.
Well, we were talking about COVID, and there's COVID this way, but there are so many different other angles that are coming into play that kids are dealing with it, that parents are, you know, the communication there, struggling with how to communicate with their kids on all of these different facets. What are you guys seeing, and what are you helping, how are you helping parents maybe look for some of those signs and symptoms of we need to keep this conversation moving?
Well, I think first of all, you need to ask the parent about their experiences, because that the parent really needs to be, the parent or the caregiver really needs to be intact and have their own set of foundation, shall we say, to be able to provide the needs of their child. So I think it's really important to ask, you know, just some general questions about the health and well-being of that child's caregiver, and start there. Start by supporting. Sometimes just a simple encouragement that you're doing a good job is what that person needs to hear, and that opens up space to then have a discussion about the specific needs of that child. And there are lots of things that the parent and the child at the home can do together to mitigate, even prevent some of the issues that then escalate and wind up needing crisis level help. And those are things like learning to talk about feelings, learning that our feelings are not facts, learning that thoughts are just thoughts and we have millions of them all day long and we don't have to respond to every single one of them. And there are lots of resources out there that kind of are some free accessible tools for parents and caregivers and even educators to go through and learn how to identify and then structure some coping skills around those. And I think we'll probably post those on the Facebook site, but the Child Mind Institute has a wonderful, very robust program that's free for anyone to go online. You can just find Child Mind Institute, and it has a great thing for kids, parents, and educators.
All right, we're going to continue giving parents some different resources, continue this conversation on mental health and kids during our special Just for Kids broadcast tonight. We're going to take a quick break. Again, there is that number. If you have a question, go ahead and give that a call, and we will be sure to raise that question to some of our experts joining us here tonight. We'll be right back.
To the first ones in the door and the last ones to leave. To the ones who redefined what it means to be a hero. To those of you on the front lines and at the front of the line for vaccinations. You've led the way in getting shots and saving lives, and set a standard we should all follow. Thank you for this year and for every day. Thank a healthcare worker. Do your part to protect your family and friends from COVID-19 and schedule your vaccine today. It's safe, it's effective, and it protects the ones you love most.
I'm Paul Mullins. This is my wife, Lori.
And we decided to get the COVID vaccine to protect our daughter, Hadley. She is in active cancer treatment for leukemia. She's never still. She's
Very entertaining.
Entertaining, energetic.
She loves to sing, loves to dance.
Individuals that haven't received the vaccine, we would encourage you to do so, again, to protect yourself and protect your children.
All right, welcome back to our special Just for Kids presentation tonight. Again, we are talking about mental health and our children, such an important topic, and hearing from a lot of you viewers tonight. Again, if you have questions, you can call this number here on your screen. Once again, we do want to introduce our panel of guests tonight. We have Dr. Carlos Asaza, psychiatrist at Woodridge Hospital, also joining with Dr. Champney here, and we have Angie Tolley here with us as well. And thank you guys again all for being here.
Thank you.
Our first question, we're going to go ahead and try to get to some of these questions, is how do you get your kids now to be a little bit more outgoing after they've been through 2 to 3 years of really, you know, making them stay indoors and trying to get through the pandemic? So now how do we motivate them?
I'll address that. I think it's important to remember that our children are actually like little investigators, and they're watching us. They're watching us to see what we're doing, and they're watching us to see how we're feeling, and they will very much mirror that. So I think modeling for them and showing them, doing things with them to get them out and to involve them in things, and showing them that it's okay and that it's safe, and that they can make those friendships, they can reconnect with people. We have to show them how to do that.
Okay, and our next question, how to treat mental illness in adults that were maybe not recognized as a child? And Dr. Asaza, we were going to have you comment on that question. Sure. Treating children when it's come through full circle.
I think, unfortunately, sometimes children don't receive that support and the care that would really benefit them early on. Early intervention is so important, and when we intervene early, we're able to make a tremendous impact in the kid's life. When we don't intervene early, sometimes things escalate and continue to become problematic as adults. And if the question is kind of broadly, how do you support adults that have these issues that have persisted when they're children, I think one of the most important things we can do is appreciate that may not be a quick fix, right? You may need to get plugged in with a good therapist, a solid therapy team, a solid outpatient team, and that can really take time to get to know you. And I think that's one of the things that Angie and the therapy team that we have working with us and supporting at our community are so outstanding at really getting to know the individual story of the patient. But I do think that things that sometimes persist over the long term might take a little bit more time to take care of. And that's where the patience comes in, the persistence comes in. I think that would be my kind of broadly speaking general tips and advice for that situation.
And it seems like too, now that we do have this state of emergency, it's very scary when you think about something like that. But it does pull all those resources together to make sure that everybody's maybe on that same page of how can we address this as a community of healthcare leaders.
Well, I think one of the things too we have to remember is that there is a historical stigma, a shame around mental health issues and needs, and we need to eliminate that and normalize the discussions around behavioral health needs. And when we normalize it, then it's suddenly no longer taboo to ask for help. So again, asking, reaching out, even if you're afraid, even though you probably are afraid, just asking for that help and continuing to be persistent and knowing that it's not a quick fix, but that you're worth it. You're worth fighting for. So ask for help.
And you mentioned too, intervening early and getting to it. It's almost like an illness if we can catch it early on. What are some of the warning signs that, maybe this has gone beyond the conversation with mom and dad and maybe I do need to get help? Because I think even as parents, you don't want to make the wrong decision. You want to guide them and help them as best you can.
Right. It's interesting, we had a question about anxiety, because anxiety is one of the most common presentations that we get, in pediatricians' offices and emergency rooms. And I think that sometimes it can be tricky to figure out when does anxiety reach that level of truly being problematic, truly being something worth seeking professional help about. And I think that broadly speaking, for each child, it could be different. But you want to be tuned into that suffering and that impairment. Those are the two keys to looking into when do we really want to seek after extra help. Utilizing community resources, talking to teachers, talking to your church leaders, talking to other trusted adults. And then it never hurts to seek professional support and guidance. It never hurts to seek out a therapist in your community. We have a tremendous school-based program, school-based therapists embedded. We have a tremendous amount of crisis support resources in our community. So don't be afraid to reach out and ask for help when needed.
And I know, Angie, when you are there for those families, you see that difference in the child and the relief maybe in the parents as they're making that progress.
Yes, absolutely. To add to what Dr. Azaza was saying as well, when symptoms are interrupting daily activities, when they're interrupting daily life, when they're stopping someone from doing the things that they normally love doing because they can't get past the symptoms, that can be a sign also that perhaps we should seek some assistance with this.
All right. Well, certainly a lot of good information. We are going to take a quick break, and again, here is that phone number. If you have a question, we would be happy to ask it to one of our panelists tonight. We'll be right back.
For I know the plans I have for you, declares the Lord. Plans to prosper you and not to harm you. Plans to give you hope and a future.
Together, we can help give every child in the Appalachian Highlands the future they dream of. Tune in to the Niswonger Children's Network Radiothon for exciting announcements.
To the first ones in the door, and the last ones to leave. To the ones who redefined what it means to be a hero. To those of you on the front lines and at the front of the line for vaccinations. You've led the way in getting shots and saving lives, and set a standard we should all follow. Thank you for this year and for every day. Thank a healthcare worker. Do your part to protect your family and friends from COVID-19 and schedule your vaccine today. It's safe, it's effective, and it protects the ones you love most.
Welcome back to our special Just for Kids presentation tonight on mental health and our children. We're hearing from a lot of parents this evening. We want to get right to your questions. Again, our panelists tonight, we have Dr. Champney. Thanks so much for being here with us, and Dr. Asaza as well. And now we have also added in Miranda Russell. And Miranda, you're a community engagement specialist. You were telling me you sort of put a lot of miles on and really have your finger on the pulse of sort of some of those rural communities when it comes to mental health.
Yeah, absolutely, Amy. So I'm much less clinical within Ballad Health, and I'm kind of a bridge between our healthcare system and the community. So I get to work with lots of organizations and help them help the people they serve.
And so that really gives that bridge, and you can then provide the resources and be that link in between.
Yeah.
What are you seeing when it comes to mental health in some of our rural communities?
Yeah, a lot of it is what's already been discussed, but what we hear mainly is from organizations who are coming to us, our Boys and Girls Clubs, our YMCAs, our school systems, who are saying, how can we help our kids and the families? And so we get to do a lot of amazing things. We have community health improvement sites where the population health department within Ballad gets to fund 21 programs like parenting, things that revolve around mental health, communities in schools, which is one of my favorite programs in our school systems. So that's one way that we help. We also do some trainings. You've talked about suicide, doing QPR, question, persuade, refer, so that we can help our organizations. We can train them so that they can then again help the people they serve.
So it sounds like it really does take a village, and that is certainly the case when it comes to mental health, because those kids may be in contact with somebody in their church, or maybe it's somebody in their school. So really, if we can all be on the same page and be looking for those things that you sort of mentioned before, what do you do if you think maybe somebody that you know through, maybe you're a Sunday school teacher, how do you reach out and maybe help for that child?
Well, I think one of the things is to just do it. So we are afraid that if we mention something that we might provoke it or trigger it. That's just not the case. So if you feel like someone is in crisis or is heading that direction, then ask them based off of your particular relationship with that person. How that dialogue might go would vary, but don't be afraid. If you recognize that there's something that's going on, just ask, and ask if you can help them get the help that they need. You know, the other important thing, and I think we sort of forget about, and we talk about it in a different section, but you know, especially in the emergency room, adolescents come with pretty big cries for help. They're really, they can be violent, they can be really excessive. So things like making your home environment safe, like making sure that if you have any sort of guns in the home, that they're locked up and that the ammunition is locked separately. If you have medications that are risky, those also need to be locked and inaccessible to anyone who is at risk for those sorts of things. We tend to put those in different silos, but we really can prevent some of those extreme crisis situations by just simply removing their accessibility to those things.
Do you see that a lot too, maybe in the hospital when kids do come in, that there may have been other triggers and warning signs that maybe were missed?
We do, Amy, and I think that, like Dr. Champney said, the earlier that you seek support and help, the easier issues are to address. And sometimes And sometimes it's easy, life gets busy. We're in the middle of a pandemic. There's virtual education. A lot of folks' work has been disruptive. But being able to tune into your kids, seeing how they're doing, and getting help sooner rather than later can really keep things from snowballing. So I can 100% echo Dr. Champney's advice of getting help as early as you can. Things are so much easier to take care of the earlier that we tune in to issues. And like we discussed, there's so many outpatient sources of support before things get to that crisis level. And things are much easier to take care of sooner rather than later. So earlier the better.
All right, some wonderful information. We're going to take one quick break. We're going to get some other questions and we will ask them to our panelists. We'll be right back.
I'm Paul Mullins. This is my wife, Lori.
And we decided to get the COVID vaccine to protect our daughter, Hadley. She is in active cancer treatment for leukemia. She's never still. She's
Very entertaining.
Entertaining. Energetic.
She loves to sing, loves to dance.
Individuals that haven't received the vaccine, we would encourage you to do so, again, to protect yourself and protect your children.
To the first ones in the door and the last ones to leave. To the ones who redefined what it means to be a hero. To those of you on the front lines and at the front of the line for vaccinations. You've led the way in getting shots and saving lives and set a standard we should all follow. Thank you for this year and for every day. Thank a healthcare worker. Do your part to protect your family and friends from COVID-19 and schedule your vaccine today. It's safe, it's effective, and it protects the ones you love most.
Well, we are now entering our final minutes of our Just for Kids presentation. Again, our topic tonight, mental health and our children, some very important information. Once again, you can call that number at the bottom of your screen if you have questions. We're going to try to get to as many as we can tonight, and we're going to go ahead and get to some of them that we just got in. One of them talking about the resources that are available, and one of the things from what I'm hearing from you guys is you all come from different areas, but you all work so well together to make sure they're getting really that continuous care. A lot of resources are available in our area.
Absolutely, and we call that collective impact. And so none of us are in this boat alone. We all come together, not only within Ballad, but also within our community. And so I think one of the best places to look for resources is in your school. Like we spoke earlier, there's counselors there. We also have amazing programs that are in our school systems. And so that would be, I think, one of the first places to collect your people that are in your child's life and let them know what's happening also, and then ask for help from there.
One of the other questions that we got in talked a little bit about masks and how kids are maybe feel one way or the other. They're really, even in schools now, kids that really want to be wearing their masks, and then you have their friends that don't, talking about how you have those conversations and how you encourage your kids to be honest and protect yourself, while maybe, how do you deal with those conversations?
Well, I mean, those are tough conversations that you could sub in any sort of other subject. So mask is what we're talking about right now, but it might be another thing where you have to make a choice, and those choices, both of those choices are kind of difficult. So having open dialogue with your child about your reasoning behind whatever choice it is that you've made, it's to mask or not mask in this situation, and having the consequences of your choices kind of discussions, and talking about separating people's behaviors from the person. So it's a behavior, it doesn't imply that that person is good or bad, it's simply a behavior. And I think that separating those two and really talking about that helps you, it just empowers you to make all of your choices in life with a little more objectivity.
And I think too, we talked about mirroring behaviors with our parents and kids. We don't realize how much we're teaching them just by how we're responding to COVID and what we've been through over the last couple of years. And you talked about how important that communication is even with your family within that element.
Absolutely. I think one of the best things we can do right now is to strengthen our relationship with not only our children, but any youth in our life. And that, relationships are like Velcro. And so the more touch points we have, the stronger that relationship is. And so one of the best things we can do is to spend time together, listening, talking, and seeing each other, and bonding in that way. And I think if that's our foundation, we can talk about anything after that.
And I know you're in the pediatric unit over there, the new area. And how important is that, being able to really relate to the different folks that are in there and for them to meet with others and kind of go through that process together?
Sure, I think the connection is critical, and that's why it's so important for when you reach out for help and support to have that solid connection with the provider that's supporting you and taking care of you. So we want to reinforce the connection between kids and their families, between the families and the kids, and the doctors and the therapists that are working with them. So it's extremely critical to have that connection, and it all comes down to that human connection and that community level support.
And you mentioned the stigma around mental health that we hopefully, I feel like we're making progress, we're starting to get better, and now we have this new generation. I mean, what better opportunity to really embrace mental health and let them know and raise a generation where that is not the stigma.
Absolutely. I mean, one of the most important relationships that you and your child can have is with your general pediatrician, that person that you go to for your routine health care and your vaccines and all of those sorts of things. So add to that list mental health, and if you have concerns, then talk to your pediatrician. There's a number of clinics here that have embedded behavioral health folks right there in clinic that can help them. And if they don't, then they can help access a lot of these community resources. So again, it's just say it. Just ask for help.
Just ask for the help, and the help will be there. As we have learned tonight, we have about 30 seconds left. Maybe just summarize your last minute advice for our audience tonight. Dr. Asaza, we'll start with you.
Thank you so much for having us, Amy. I think that we could sum it up. Just don't be afraid to ask for help, ask for support, and know that you are surrounded by a supportive community. I think that would be my take-home message for tonight.
Okay.
Yeah, I think the fact that we're having this conversation now shows that the stigma is lessening. One of the most important things, again, have strong relationship with your children and the youth in your life. And mental health is health. Just like Dr. Tampney said, that we can talk about that with our doctors.
All right, well, thank you all so much for joining us tonight, and thank you for joining our conversation. Have a lovely evening.